Okay. Perhaps you might say your name and exactly your role in the hospital.
I'm Dr. Wilbert Hurlo. I'm the medical superintendent. I've been here on and off since 1972.
Goodness.
So I've seen the hospital develop, the medical work in Lesotho develop, and yeah, we're very pleased to have visitors come, interested to see what's happening and see if they can help.
What was your particular interest in coming to work here when there's so many wonderful opportunities for you in South Africa?
As a member of the Seventh-day Adventist Church, I was aware of this hospital. I visited it as a medical student even before I qualified, and it's just been a sense of commitment to build up the medical work of the church, and it's been very rewarding, very interesting time being here.
Have you had a lot of doctors from outside, or as well as inside the country? What's the percentage of Lesotho doctors here and doctors from other countries?
One of our real problems is the lack of doctors from Lesotho. We've never had a long-term doctor from Lesotho. We've tried several times to get doctors. There's now a very significant move on the part of a Lesotho-Boston Health Alliance partnership to try and alleviate that problem. We can divert into that if you'd like to know more details. I don't know if you've heard of it or if you're aware of it. But otherwise, it's been doctors from South Africa, and then doctors from America, Australia, the UK. In recent years, though, most of our staff have been from other African countries, Nigeria, DRC, and Zimbabwe. And unfortunately, often those doctors come here because of turmoil in their home countries. And so, in a way, it's refugee doctors. And one of the greatest needs is for developing countries is just to realize that the brain drain is terrible. Doctors, nurses, and so on, who should be working in their own countries are moving to greener pastures.
Well, yes, you're aware of that problem. You don't know the solution. For instance, from here to South Africa, there's movement that way, presumably. Right. And I don't know if you have a solution, a way of stopping it. I think only if the work in the hospital is sufficiently rewarding and encouraging, but even then the salary's against it and so many things are against staying, right?
You've identified the features. There are many doctors who would like to work in a rural setting where they feel they're really making a big difference, but they're not going to work for such a low remuneration package that they feel they can't look after their families, etc. And so the Lesotho-Boston Health Alliance, working with the Ministry of Health, is addressing this very problem, and they are now doctors, and Maluti is one of the training hospitals where doctors are getting a specialty in a very general way. It's not the family medicine of America. It's sort of general practice. But it is being spearheaded by the Boston University Medical School, the Department of Family Medicine. And it started now in January. Laribi Hospital and Maluti Hospital are the initial two training sites. And they are looking at the remuneration package. These trainees will be assured of a much livable wage. And then they're also looking at the working circumstances. They're working on nursing services, upgrading the ability, the performance, and the administration. So these three key areas, the Berea district and the Laribi district, are the pilot areas for Lesotho. So,
in the case, for instance, of doctors, would they recruit Lesotho, natives of Lesotho, who've studied elsewhere and qualified, for instance, at Wits?
That is exactly what's happening. The plan is for doctors who have trained in South Africa or anywhere else,
Yes.
come back to Lesotho, get this training. It's planned to have a total of 6 doctors being starting out each year for a 4-year training. So over a few years there'll be 24 doctors in training, and then they will staff the government and the mission hospitals with doctors who are eminently, with the practical training, able to cope well with the work and have the working environment improved to the point that they're happy to stay long term. So this to me is one of the most significant things that's happening in Lesotho healthcare at the moment.
For this year, 08, have you got recruits?
Yes, it was planned for 3 or 4. 2 have started already, and it's hoped as soon as suitable candidates are found, the numbers will increase.
And nurses also?
The nursing situation in Lesotho is much stronger in terms of having nationals here who know the culture, they know the language and everything. Maluti Hospital is one of the largest nursing training institutions in Lesotho. We are graduating 30-40 nurses every year, and so Boston is in fact looking at upgrading the situation for ward management and organising the way that things happen in hospitals. Just to make sure that the nurses also are pleased with the work environment. And the government is looking very seriously at upgrading salaries. And so I think the prospects are quite good to strengthen the...
That's her word, hope. She teaches me hope. This is very important. Now, one thing is that, from my own experience and others, one of the problems doctors have is children. As the children get older, when they go to school, are these schools, say a family lives here, and the children become 3, 4, 5, 6, 7, are these schools when they go to boarding school?
Maluti, for 20 years already, we run our own primary school for staff children, and I think that's one of the reasons why Maluti has tended to have more staffing levels, fewer vacant posts than other hospitals, because that is happening. Then, of course, when it comes to high school, then
they go to boarding school probably.
Have to go to boarding school.
And you could do that in Swaziland or Lesotho or wherever.
Sometimes in Lesotho or South Africa, there's excellent schools in Bloemfontein, which isn't too far away.
Now, I don't really need to know much about this, but where does the money come from for the hospital?
I'm pleased to be able to mention the fact that for many years, 50% of our operating income has been coming from patient fees. About 40% from the government of Lesotho, and about 10% from donations from the Seventh-day Adventist Church, and then a large number of other donors. We are right now in a transition period. That the government has a new plan for the mission hospitals where we will be lowering our fees, and the government will give increased funding to cope with that. Now this is quite challenging, because there can be some legitimate questions asked. Will the reimbursement, which is delayed at the moment, and at the moment we're really struggling financially, but we feel that if the government will implement this ideology correctly, then it can work well. There will be the provision still for private practice, patients willing to pay more for more specialized things and so on. So that's a sensible approach. But the amount of poverty is serious and extreme, and so as long as the completely destitute are still taken care of.
Right.
We feel that's very important. And of course, to cope with the TB and AIDS patients,
Right.
that's very important. You've just been looking at our wellness centre.
Right.
We are concerned that large amounts of money are coming into the country, the Global Fund, the Clinton Foundation,
Right.
and others, and a lot of that is going to build up systems, in Maseru, plans that the government hospitals in the districts and all the mission hospitals, including Maluti, we are very challenged because we are not getting the money to have nice facilities. We've just had to do on-the-spot renovations and so on. And there are plans, but they tend to be in the future, and it tends to be not a sense of urgency amongst the donors and the government to say this AIDS crisis has been going on for many years already, and the help to the doctors and the nurses who are in the hospitals, in the clinics, doing the work, that help to them must be upgraded and urgently. A large amount of funding must go to the government, to strengthen the planning and the education of the whole the country. But it is very true that Maluti, as is true with other mission hospitals and so on, we are not getting significant funding from the big donors coming directly to us for our needs. We're on-the-spot managers. We can change day by day or week by week as different needs arise, as there's a breakdown in our X-ray equipment. This very morning, technicians are repairing our X-ray. And we phoned yesterday and we said, come and do it. This is the way we like to work. We don't like to have to have requisitions, go to Maseru and wait for a month before things are repaired. But our autonomy and our ability and enough funds, to do these day-by-day management decisions locally is being eroded. It's very idealistic to have a lot of grand plans at the central level, but that must be balanced by the enough funds available on the spot for us to keep working.
And I heard that there were some other programs related to the hospital, like whether it be outreach or things to do with agriculture, or rather maybe extension programs. I'm not quite sure exactly what those are. May you speak a bit about that as well?
Yes, for many years we've known and tried to build up the importance of work in the community. So there are the health centres where there's a nurse clinician and her staff in the community. We also have what we call just outposts where we go, and all the time we do try and have education being done at village levels in the schools and so on. So that takes our staff going out, hospital vehicles, visiting. Besides education on TB and AIDS and general health, we have been looking at trying to train people for home-based care. We have had, going back 8 years, the first program, we had a donor give us some money to start that. But donors often will have a project for a year or 2 or 3, and they want us to continue, we want to continue, but it's just so difficult to continue without funds coming in. And we've been very strong in the area of nutrition and agriculture.
Oh, good. Tell us about it.
We have been going to the communities and encouraging them to improve both garden, growing vegetables, fruit trees, and then also the crops, the maize, the sorghum, and so on. And one of the best examples of what we're doing is our greenhouses at the village level. We have a hospital garden, we have a demonstration greenhouse and demonstration vegetable growing and fruit trees and so on. And but then we show people that if they have a greenhouse, to get seedlings and other young plants started early in the growing season, protected from frost and hail sometimes, and then the stronger plants are put out in the garden, and as well as just general advice on improving the level of agriculture. We've had several different owners work with us. Again, it's going back 7-8 years now, and again things tend to go well while the project is there, and then it's a real challenge and struggle again once the specific project has ended, and the village people have gained, the particular village that we're working at has gained the knowledge, but there are some 240 villages in our catchment area, and we certainly want to keep going to different villages, and some upgrading courses for those that we've been at before, because we really like to have a holistic approach, and we want, we realise that it's no good just doing the curative services here in the hospital. We really want to work in a preventative field with knowledge and motivation of people to keep well, good lifestyles, and then good nutrition. We've also been involved to some extent with income generating projects, and then also taking healthcare closer to the people, so that they don't have to travel long distances to come to the hospital. This requires vehicles. At the moment, all our vehicles are old. We've had a huge number of breakdowns and repair expenses recently, and this is just illustrating the fact that we have these ongoing expenses to try and work in the community, and we see that the big donors, they don't really come and talk to us. They don't have enter into sort of agreements and understandings readily. Often it's the idea is that there will be a specific project with a starting and an ending date, and that's fine. We're happy to do it. But sometimes people have to say, well, what about infrastructure and the support areas of vehicles and renovating our buildings? As you see, we really need some major renovations to the hospital and so on.
But I must say, just walking in, it's one of the cleanest ones I've ever been to. I'm proud to say I was born here. Thank you, Lord. It's a good one. It's a good example. But really, but seriously, I just noticed, exceptionally clean windows. Everything is clean. It's well taken care of. I can sense a sense of fluency and efficiency here that I haven't had the spirit of in a number of places that we visited. Just honest. So I appreciate that. Really, we appreciate that very much. And see that there's a special type of dedication to the work you do here. Yeah.
Well, I will pass on the remarks to the rest of our staff. Maybe you could even write a little letter and we'll put it up on a notice board.
Yes, we will. At least
it's so nice to have people sort of look beyond the floor tiles that are worn out, and the ceilings that are sagging and so on. But if I can stress the point, we really get worried about old electrical wiring and the danger of shorts and fires and so on. We know that we have to keep up our infrastructure. And so on, and we were really challenged, by not getting sufficient funds to do that.
Right. I was just thinking on the question of the donors in the HIV, like the Clintons, they are really basically providing the drugs, isn't that right?
Right.
You're getting your ARV drugs free.
That's right.
From them, so you do get that. They don't limit that. You just whatever you need in the drugs you get. They don't help on the personal side. That thing. Yeah.
Again, that's analysing the situation very correctly. It's a wonderful boost to get free antiretroviral drugs, but we've done the analysis. You take the total cost of our clinic, we call it the wellness centre, and for staff, for electricity, for the lab tests for everything else. And it was about 500 rand or per patient per month. And the plan from the government level was that we charge 10 rand per patient per month and we get free drugs. So I think that gives you the sort of challenge to run our wellness centre when our income is free drugs and then 10 rand, but there's still a lot more beyond that to really be able to run the centre properly.
And she explained to us too downstairs that you only get the actual ARV drugs, you don't get the other drugs that the patient almost certainly will need.
That is correct.
So what happens then? Oh, I'm so sorry. But what happens then if, you know, it's just half done? Or what happens?
Well, I'll mention this. Technically speaking, at the moment the hospital is bankrupt. Our assets are less than our liabilities. The savings that we've had to replace vehicles for renovations and so on, we've spent them, to excuse me, you're coming to the real point of what's going on. We are really trying to make things happen, and the finances are, just essential. And we have had tremendous challenges the last year and a half, and unfortunately the message isn't really getting through to the people in this area that it needs to get through. There is money in this area, it is not getting to where the work is being done. And this is a huge challenge, and it's really, so encouraging to have people who will come and appreciate what's going on and are wanting to help. But we are, it is a transition period going to the new system, but it's a huge concern to us that we are not being heard by the people that, it's their basic responsibility. Money is coming from donors, but we see some financial reports. The Ministry of Health has a surplus. It did not pay the mission hospitals what it budgeted, and it has a surplus. So, we talk about transparency, we talk about, democracy, and we talk about partners, but here the mission hospitals are not being treated as fair partners with government. I talked about the fact that the Maluti Hospital for many years has been getting 40% of our funds from government. Well, for the last year and a half, that has dropped. Again, it's bureaucracy and it's multiple planning meetings in the hotels in Masiru, and it is not being translated to work here. We protest, but our protests are not being heard, and this is causing huge strains and frustrations. So this is, this interview is getting right down to the very, the core of some of the issues, but that's all for the good, because there are just so many patients who can really benefit if the true picture is out in the open.
I think I tend to agree with him. I think one of the major problems really is that of bureaucracy. But in addition to bureaucracy, there's also the limitations, I think, at national level of people appreciating what's really going on at the operational level. And I won't specifically just talk about the mission hospitals alone, but in general, I think that is the big problem. And also, we have a problem of following up on not just issues, but like he mentions, a lot of workshops, a lot of trainings. some of them are a bit cosmetic. I mean, it's just more like a show. Now I have this for this one, I have this for that one. Or sometimes with good intentions, but then if you are not following on what you studied, that really puts a lot of strain to people working at the operational level. Even at national level at times it's very difficult because you will have caught a certain approach to say, well, this is the approach we are taking. The next time you come and say, no, we are no more taking that approach, we have changed. So in a way, it creates a lot of confusion and frustrations, and especially on the budget issue. The point he's making that if we can say we had surplus and yet other places didn't have anything to go by, I mean, it means we are not, using our things effectively. So that link with the missions, I mean, there's a serious problem of bureaucracy, let me put it that way. Because if somebody has a need, instead of picking a phone and say, I'm a technical person, I need this technical response, you do not have any single person that you can pick a phone and talk to that person and know that you'll get the answer. So what tends to happen is the message will be relayed, wait for somebody to make a decision. The person who's supposedly to make a decision needs to also consult someone else. And that other person has been told, no, you should go this direction. So even in terms of maintaining a similar pool of people who are like-minded, it's very difficult because we keep shifting. I mean, I may come today in this capacity, but next time I come, I'm totally working something totally different. So really, I do appreciate what Maluti have done. It's not only in the quality of service they have done. They have had a good quality service in the hospital itself, in public health, even on HIV/AIDS issues, and also in having an identity of an institution that you can identify as providing this type of quality work. So really, maybe the platform to tell it to the hospitals haven't been many. One of the reasons I brought the Smart Partnership group, that is a number of people who are coming from Malaysia, from Singapore, from people who are in the Smart Partnership movement, was because they are more organized. The structures are clear, you know what to expect. Even though there may be challenges, but at least you have the vision, you have the direction, you have the commitment. And also, really have been doing this for a very long time, and I know of your field work on eye specialties, for example, they do go out and provide that type of service. So in a way, I'm just trying to say it is because we are acknowledging the type of work that you are doing, the work that you are doing. Even by coming here as CD Foundation, I wouldn't say partly because we want to get as much information as we would like to give, whatever is possible to get. But we came here because of the track record of your institution. It isn't about the challenges only that maybe the infrastructure is not where you like it to be, maybe financially you're challenged and that, but it is because of the kind of work that you're doing, which other people, when they hear, it can be inspirational to other people, whether local or international, because people can't even put themselves in a position to think, can this situation really happen? But if you get it firsthand, because it's not like relaying what has been said, it's something that you are saying yourself. So really we appreciate your sharing your sentiments as well about the institution. So in brief, as somebody who's living here, I do appreciate what's done in Maluti, and I'm not the only one. We just don't have a platform to celebrate what you are doing, but we are appreciative of what's happening here. And many other child institutions like Mauritius, I'm in government, but I'm aware of the challenges that we're talking about, and the appreciation is there, but the platform for expressing that maybe is what's lacking. Maybe we need to be a little bit more proactive in visiting, not only to visit when we have guests to show them around, but to in a way that you are also aware that
knowledge.
Yes. thank you for your comments. To complete the picture, what I didn't mention was Maluti is really quite active with the HIV/AIDS and vulnerable children.
Right.
Again, it's mainly from small donors, visitors, family members, send a little bit here, a little bit there, and that's a huge area.
Right. You get consultations for ways, like in Missouri, we saw the pediatric, the Baylor Pediatric Hospital, and I was told that this is a great place for pediatric consultants, but it's a bit far from here.
That's right. It's wonderful to have one centre of excellence in the country, but the people who live around the rest of the country, things need to be improved.
Right. Wonderful. Well,
Very wonderful. Thank you
thank you very much.
So much.
Well, it's a pleasure, and it's a good investment of my time to speak to visitors who come and are interested in knowing what's happening and perhaps helping. Yes.
Can I take you one of those?
I brought this specifically as we need to print more, but I've got 1 or 2 left. Just
Are they in English?
Yes.
LESOTHO. Okay.
right.
That'd be wonderful. Just one would be great.
Yeah.
Big copies.
This is what any visitors we come, we're happy to give a copy. Then let me also give you my email address, and then I would be really pleased if you could maybe just give me your
details.
or
You can
give
also
a business card.
I was looking for that. I know it somewhere.
I used up my last business card, which she promised me she's going to give me.
Might be in the other band. We were both teaching,
Okay.
and my mom was always good performing. Very tough groups. And then we left for the United States about 2 or 3 years later. I film, so those are the things I did. So then eventually I moved to New York because I was in Massachusetts before. I then moved to New York in '97, that was 10 years ago. Oh, che forma di lavoro è lui? Allora, che mangi mangi? Che Five down, 8, 5 to 7.
Oh my God.
She's now the star of the Lion King. You've heard of the music? Yeah, right. Wow, really? Incredible. Fantastic.
So this is my first time. Oh, I remember kids.
Really?
Since that glorious day.
Yeah.
On earth alive.
I don't think you would have been present in 20 years. The problem was, it was smart and nice and close to 2,000. It's very overcrowded, and we just never had the funds is to renovate and extend the maternity ward. Terrific.
Great. We'll come here on another trip. And I hope you'll be here to take us around.
More seizures because that helps. As we get more antiretrovirals that the mother takes, then it drops the need for a lot of seizures.
I was a cesarean anyway.
But it's in class.
It's marvelous how much light you have here. At least it's not so depressing as some of the hospitals in New York. You light and beautiful.
Yes.
Yes.
You